Hey, so I want to drop a video addressing the Instagram post that I had yesterday where I let you guys listen to a voicemail that a prospective patient left the night before and was reading off of the script that her doctor gave her, and she was shopping for a physical therapist that did something called EWST, something I have no idea, it must be the new greatest fad for physical therapists that are too lazy to figure out what they should be doing. And of course, dry needling, which physicians think is great because clueless physical therapists who like fuckery have taught them that dry needling does something that it doesn't. Electrical stimulation and tape or ultrasound or some other kind of PT bullshit. So I want to address that situation. So hopefully if you're in this group, you're following me, you understand that all of those options are nothing but lies that lazy physical therapists tell patients in order to trick them into coming in and being a patient. Or physical therapists, more likely like new grad students, are doing these things because they've been told to do those things because that's what's expected. And physical therapists just need to fall in line and do what they're told because that's what we do so we can charge patients even though they're not going to get any better, even though we're not applying anything that we learned in school. It's just the game that we play so we can get paid and run patients through the mill. And after 6 to 8 visits, when they're not any better, we just say, well, go back to the doctor and get an injection. So when you play this game and tell patients that if that's what they're expecting, that's what you're going to do. When you do that, you make yourself look like a jackass, and you make me look like a jackass because unfortunately I have the title of Doctor of Physical Therapy, which basically means nothing other than glorified personal trainer that does fuckery in order to cover up patients' symptoms. So unfortunately for us in the field that want to do something that actually works to help our patients return to normal function, who want to use science as our guide and build our practice off of scientific principles, the rest of physical therapy that has gone full speed into complete fuckery has screwed us. So when you play this game, if you know that there's something better, but you still do what's wrong because patients expect it, you just made yourself and me look like a jackass. What you should be doing and saying, I'm not going to do that with you. In fact, I don't even have that option in my clinic because I don't put garbage in my clinic because I know it's not going to help patients get any better. What I'm going to do instead is do this, which will get to the root cause, which is this, which will help you long-term because of this. And I'm going to teach you how to do these things to keep this from coming back, rather than saying, oh, you're a moron physician that didn't screen you, didn't assess you, didn't do anything to figure out what the root cause of your symptoms are. All they did was listen to you say, my back hurts. Oh, okay, I'm going to treat your back pain because physical therapists are supposed to make you feel better. We went to college, we went to undergrad, we went to grad school for 7 years, accumulated hundreds of thousands of dollars of debt so we can make people feel better. Who cares? Any jackass on the street that knows absolutely nothing about anatomy, physiology, biomechanics, problem solving, root cause analysis, critical thinking, you need to know nothing about that to do ICE, STEM, dry needling, EWTS, whatever the fuck that is, orthotics, stretching, foam rolling, Theragun, bullshit, 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 which is what we've been stuck with because when you accept that, you are pushing the narrative. When you work with other people in your clinic who do that bullshit, even though you don't do that bullshit, if you're not telling your patients, this is why that idiot is doing that over there, and this is why we are not going to do that, because watch, that patient is not going to be any better when they walk out of here. Watch, that physical therapist is not going to assess function when the patient walks in, and they're not going to assess function when the patient walks out, because what they're doing is symptom modification, and treating symptom modification will not reverse the root cause, which will not increase your function. But what it will do is decrease their short-term symptoms. So when they get done doing their 30 minutes of fuckery over there, the physical therapist will say, do you feel better? And the patient will say, ooh, yeah, that feels good. I like that. And The physical therapist counts that as a win and has just taught that patient that the only thing that matters is feeling better for the next half hour. So when you are ready to stand up and call out the physicians that are full of shit, and the physical therapists that are full of shit, and the chiropractors that rip people off, and the massage therapists that rip people off, when you're ready to stand up and call those people out, then our profession will move forward. Until that happens, we will continue to be physicians' flunkies. We will continue to be glorified personal trainers who do Theragun that a personal trainer can do, that do massage that somebody without a license can do, that do cupping and needling and tape and stretching and corrective exercise, which you do not need a license to do, which you do not need 7 years of school to do, which you do not need to be a doctor to do. All you need to be is a moron that wants to make people feel better for the short term. You don't need a license, you don't need an education. Why are you, as a doctor of physical therapy or a doctor of chiropractic or a certified athletic trainer, why are you taking yourself down to the level of basically a high school graduate instead of pushing for quality care, for quality evaluation, for quality assessment, for quality treatment, for quality patient education, for quality exercise prescription and programming? Why aren't you doing that? If you aren't doing that and you're playing the physician's bullshit game of spread fuckery and make people feel better for the short term, you are the problem. If you're tired of being the problem, if you're confused and you don't know what I'm talking about, but you know there has to be something better than the bullshit that you're doing now, that means it's time for you to get in the shift. Because as far as I know, when I look out there on the landscape of continuing education, residencies, all that stuff, it's doing nothing but pushing the narrative of fuckery. There is nobody out there who's teaching critical thinking, who's teaching you how to get to the root cause. And don't let somebody tell you that the root cause of somebody's problem is subluxation. Bullshit. Don't let somebody tell you that the root cause of somebody's problem is tendinitis. Bullshit. Those things happen because there's dysfunction somewhere else that happened way before that. Herniated discs is not the root cause. Pain is not the root cause. Swelling is not the root cause. All the stuff that you've been brainwashed into thinking is the root cause is not, which is why you do cupping, needling, orthotics, stretching, correctives, foam rolling, bullshit. That's why you're stuck with that. If you understand that what you're doing isn't working and you don't know how to do something better, let me know. I can teach you how to use critical thinking in order to get to the root cause so you can use the education that you spent hundreds of thousands of dollars and years to obtain. That's what we do in the shift. I can reinvent your career in less than 4 months for a fraction of what you've already invested and get you out of the bullshit, get you out of the confusion, get you away from the physical therapists that are on the other side of your clinic spreading false narratives and nocebos instead of thinking and doing what's best for their patients. When you're ready to do what's best for your patients, when you're ready to have a real career instead of a job, you're ready to make real money, you want to go off on your own and own your own thing and do all that, I can teach you how to do all of that in less than 4 months. DM me.